Good afternoon, everybody. I'd like to welcome you to the Tidewater Community College Town Hall to discuss the reopening of the college. My name is Kim Bovey. I will be your moderator today. I am joined by Dr. Conston, the president of Tidewater Community College, and the entire president's cabinet. She will do some introductory remarks, but I first want to have a few comments and let everybody know that I have received over 150 questions and comments related to the college's reopening. I really appreciate those of you who have returned my emails when I asked for clarifications. I want to thank you for those clarifications. And I want to let you know that all of these emails and questions will be held in the strictest confidence. We will do our best to answer as many of these questions as possible, but please understand there are a wide variety of thoughts and comments and questions coming in, so we'll try to cover these as best we can in the next hour and a half. I'd also like to remind everybody that this is, as you know, a very fluid situation. Times are changing constantly, even day to day. And so what might be germane today may be changing in the near future. That is something beyond what any of us can do. But without any further ado, I'd like again to welcome you to this town hall to discuss the reopening. And I'd like to pass this on first to President Conston and let her share some opening remarks with you.
Thank you very much, Dr. Bovey, and good afternoon, everyone. I too want to thank you all for logging in today so that we could provide you with an update on where we are with the college's reopening plan for the fall of 2020. We know that it is very important that we continue to communicate with you frequently, and so today is another effort to do that. We want to let you know where we are, and we want to talk very much in detail about the reopening plan that you will find located on the homepage of the TCCC website. So I also want to let you know that the cabinet has been working very hard during these past several weeks to address the multiple questions that are continuing to arise, not only here at TCC, but also across the state, as well as across the nation, so that we will have some good responses as we work through a reopening for the college. And as Kim has said, certainly we are living in very difficult times. Things are so uncertain right now, as we all know. The issues around the pandemic continue to evolve daily. The situation is very fluid, and we are working as hard as we can to comply with all of the variables that we are having to respond to, but also to ensure that we are in compliance with what the governor is advising us to do on a day-to-day and weekly basis, as well as ensuring that we are working in collaboration with the VCCS. So much of what you hear today will definitely be driven by all of these factors. I also want to let you know, as Kim has mentioned, all of the cabinet members are in the Zoom room today, and you will hear from 4 of them specifically, but the others are here to be able to respond to any questions that we may not address during our talk with you over the next 30 or 40 minutes. So I would like to introduce those individuals who will be speaking to you today to respond to what we have been doing these past several weeks, trying to prepare the college for the reopening. And they will speak to you in this order. Dr. Michelle Woodhouse will speak first. She will give a very thorough overview on the SHEV plan, which was submitted just a couple of weeks ago. And I want to extend a very warm thanks to Dr. Woodhouse because she really chaired the cabinet team in putting together the plan. Also, Dr. Karen Campbell will speak. She has done a lot of work on preparing the college opening as it relates to the students and all of the student services. So you will hear from her after Dr. Woodhouse. Then you will hear from Matt Baumgarten. And Matt, of course, he and his team have been working to ensure that we all of our facilities are in place and that we have the PPE equipment that we need in order to be able to provide the services that we need to each of you. So you will hear from him on many of the details that we have engaged in. And then finally, Beth Lundy, who is our Associate Vice President for Human Resources, will speak and address many of the questions that we have received that focus on what we are to do from an HR perspective. And after you hear from these individuals, we will spend some time answering additional questions that may arise. And certainly Dr. Bove will facilitate that process. And perhaps if you have a question to be directed to an additional cabinet member, that individual, as I mentioned, is here to respond. So without further ado from me, I would like to ask Dr. Woodhouse if you will start facilitating your portion of this conversation. Thank you so much.
Thank you, Dr. Conston, and thank you to everyone for the opportunity to address you regarding TCC's response to the COVID-19 plan for fall 2020. As stated in the plan, since May, members of the cabinet, facilities, and other stakeholders work diligently to create a plan that is in compliance with the directives of federal, state authorities, and VCCS guidance, all of which indicate the steps that have been taken to minimize the risk upon return of students, faculty, and staff to the campuses and the college. Recognizing that, of course, this document is fluid and many people have participated in the development, we know that there may be some inconsistencies which we are continually updating. However, it is our intent today to be very clear about the expectations going forward as we prepare for the reopening of TCC. Therefore, we do appreciate your patience and your understanding. TCC's fall semester will begin on August 24th. At that time, only performance-based courses that cannot be delivered online will be held face-to-face. All other courses will be delivered synchronously or asynchronously, minimizing the number of faculty and students on campus. TCC will repopulate the college and campuses in a safe and sustainable manner in accordance with CDC guidelines. With the virus's uncertain future, it is imperative, of course, that all students and faculty follow the guidelines as discussed today and as outlined in the plan and messaging throughout the college. Following the steps to support the health and safety of our campus community, as pursuant to Phase 3 of the Governor Northam's Forward Virginia Blueprint, students and faculty will follow the following guidelines. The guidelines are as follows. Number 1, students and faculty and staff on the campus will practice physical distancing and remain at least 6 feet apart. Number 2, face coverings will be required inside the buildings and classrooms. Students, faculty, and staff will not be admitted to any TCC building without the appropriate face coverings, and that could include a face shield. Signage to enforce physical distancing and elevator occupancy is located in all buildings and elevators to help direct traffic and control the number of people on the elevators. Plexiglass shields are installed in all front-facing employees who are on the campus, student services, libraries, and in the classrooms. A thorough daily cleaning and disinfecting protocols will take place daily. The plan does state that no more than 50 people will be in the building at any one time. However, when the governor moves to Phase 3, that of course has increased to 250 people, and the plan will be updated accordingly. Therefore, no more than 250 people will be in a building at any one time. Students, faculty, and staff will be informed of how to maintain safe habits prior to returning to campus by requiring to review a safety prevention video, which will be shared through Canvas and social media platforms. Objects that could be potentially shared will be removed from public areas. PPE will be available to faculty, staff, and students and guests who do not have appropriate face coverings or access to face coverings. Students, faculty, and staff will sign in to each building daily. This will begin on August the 3rd. All faculty must read and sign the Faculty and Staff Health Safety Agreement, Appendix D. Faculty staff return to work, page 48 of the Response to COVID-19 and Reopening Plan, and turn it in. Of course, some will turn it into their pathway dean, others will turn it into their supervisor, and this must be completed prior to the first day that they come to campus. For faculty, only one signed document. For employees, only one signed document, and it will be turned in on the campuses to the campus dean. At the district building, it will be turned in to human resources, but we must have these signed documents on file. This document is very important, and again, we must keep this document on file. Again, as we've stated, all faculty will sign in when entering any TCC building. If they exit the building for any length of time, they will sign in when they return back to the building. For those who may wonder what floors will you sign in on the district building, you will sign in on the floor in which you enter. In terms of the communication, our communications plan, of course, is very multi-layered, and it is ongoing. TCC has been communicating with students and faculty really since mid-June, and really since all of this has broken out. And for the upcoming fall semester, we're continuing to communicate on a regular basis. Dr. Conston has worked very diligently to continue her communication with everyone. She's held numerous Zoom town halls with all stakeholders like we're doing today. She has been very intentional about her communication and her written correspondence to everyone. She has sent emails about the fall 2020 and has recorded a wellness check video. Our strategy is simple: to emphasize all the positive initiatives happening at the college and to communicate how we are protecting people and advancing education and student success today. TCC will implement a brief building closure of COVID-19 if an infected person has been in that building, regardless of the community level spread. Once the local health department confirms a positive COVID test, health officials will notify TCC. Health officials will assist TCC administrators in determining a course of action, including whether a short-term closure of campus spaces or building is needed to ensure there is adequate time for cleaning and sanitizing. And I emphasize this because this is very important, because some may ask, will we always close an entire building? And again, I want to remind everyone that we act in response to our guidance from the local health departments. Local health officials' recommendation for the duration and extent of class suspensions, buildings, and facilities closures will be made on a case-by-case basis using the most up-to-date information in COVID-19 and the specific cases in the community. Communication and dismissal or shutdown will be sent via TCC. If an emergency shutdown is required, we will activate TCC alerts, but only if an emergency shutdown is required. Otherwise, you will receive your correspondence through TCC all. If a faculty or staff member or a visitor indicates that they may have been exposed to the coronavirus, advise the employee to immediately contact his or her medical provider, who will make an assessment and report any potential exposure to the local health department. If a student indicates that they have been exposed to the coronavirus, advise the student to immediately contact his or her medical advisor, who will make an assessment and report any potential exposure to the local health department. I would like to speak briefly at this time about the libraries. The City of Virginia Beach, including the Virginia Beach Public Libraries, at this present time encourages the use of face coverings, but does not require them to require patrons to leave facilities for using or refusing to wear face coverings. However, TCC is requiring the use of face coverings and in libraries, including the joint use library. Therefore, the joint use library will follow our directive at the present time, which is requiring the use of face coverings. All of our libraries will require the use of face coverings, and at the present time, we are only servicing TCC students and we are not open to the public. TCC is reconfiguring all library spaces to enforce social distancing and is requiring, of course, as I just stated, the use of face coverings. Aside from cases where a mask is needed to respect social distancing, we will also ensure that all computers are cleaned and sanitized and all areas are cleaned and sanitized once the student is finished with that particular area. The last areas that I would like to speak about very briefly are the off-campus facilities, the Visual Arts Center, the RAC, and the Roper, as they will follow the same protocols as the campus and district. At the present time, the Roper does not have any events scheduled. However, they are looking to expand their academic programming in a virtual manner. While I know I have shared a lot with you, I did want to present you with a brief overview of what the plan does entail. As Dr. Conston has stated, many colleagues, we have all worked together, and each colleague now will provide a greater detail of many of the things that the plan does provide. Dr. Campbell will share a greater detail about returning to campus and the training and what that looks like. Matt Baumgarten will talk about the hygiene practices, cleaning and disinfecting protocols. And Beth Lundy will talk about the Office of Human Resources. At this time, I will turn it over to Dr. Karen Campbell. Thank you.
Thank you, Dr. Woodhouse. And what I'd like to do, as Dr. Woodhouse has shared with you, is explain to you the Student Affairs and Student Support Services reopening plan. First, I would like to thank the members of the Student Affairs Safe Reopening Committee who contributed to the plan I'm sharing today. The members of the committee include Deans Emmanuel Chestnut, James Edwards, Kia Hardy, Dana Hathorn, and Kevin McCarthy. Student Affairs staff members include Jennifer Perkinson, Meredith Pollard, Crystal Stafford, Apple Tarvis, and Veronica Cianetti. So I would like to thank them for their work. Here are the details of the plan developed by the committee. So starting Monday, August the 3rd, Student Support Services will be available on campus for students who do not have access to technology, need assistance with the enrollment process, or have to drop off documents. As Dr. Woodhouse stated, on August the 24th, campuses are also open to students enrolled in the fall 2020 face-to-face classes. On-campus student support services available are admissions, enrollment, advising, Veterans Affairs, business offices, ID offices, and financial aid. The hours of operation are Monday and Tuesday from 8:30 a.m. to 6:30 p.m. and Wednesday through Friday, 8:30 a.m. to 5 o'clock p.m. The hours are subject to change as we get closer to the start of the semester. Some student support services are available outside of these hours, and those include testing services, ID offices, and open computer labs. Testing services will be available to current students by appointment only. To make an appointment, students should email the appropriate testing center. Student ID card offices have temporary locations so that we can limit the number of buildings open for student support services. The ID card offices are located in the following temporary locations. On the Chesapeake campus, they will be located in the Pass building in the Cedar Room 154. They will be open on Mondays from 9 a.m. to 5 p.m. On the Portsmouth campus, they will be located in Building A in the Counseling Suite, and they will be open on Tuesdays from 9 a.m. to 5 p.m. On the Norfolk campus, they will be located in the Andrews Building at the Welcome Desk, and they will be open on Wednesdays, 8 a.m. to 4 p.m. At the Virginia Beach campus, they will be located where they are currently located in the Student Center, which has a separate entrance in room K105D, Thursdays 11 a.m. to 7 p.m. Starting August the 3rd, computer labs will be available in the library for students only, Monday through Friday from 9 to 5 p.m. on the Chesapeake Pass building. They will be located in the Chesapeake Pass building in Norfolk, in the Martin building, Portsmouth in Building A, and Virginia Beach in the Joint Use Library. We are limiting the number of buildings open for student support services. So open campus buildings for student support services start August the 3rd. And those buildings are the Pass building, which is located on the Chesapeake campus. It is the main entrance. Andrews building, main entrance on the Norfolk campus. And Building A, it's the entrance facing the quad on the Portsmouth campus. Located on the Virginia Beach campus, it is the Bayside building, Building B, and that entrance is facing the parking lot. One entrance to these buildings will be open to serve students who need assistance with the enrollment process and do not have access to technology. At each entrance, there is a check-in station that will have disposable masks, disposable face shields, and wipes. Students will sign in after reviewing the health condition assessment, use hand sanitizer, and observe the social distancing signs. Signage and the welcome desk attendant will direct students to the appropriate next steps. A detailed plan for serving students has been developed for each campus and will be shared with students via email, a future town hall, and Zoom sessions. In general, students will be served in person by staff practicing social distancing and using PPE. If it is not possible to safely serve students in person and practice social distancing due to spacing challenges and capacity in an office area or hallway, students will be directed to a virtual student support area to use a computer equipped with disposable headphones and will meet with staff virtually. If students request privacy or need a phone to access Zoom, each campus has identified an office for students to use one at a time. Additional signage, of course, will be available on the campuses to help direct students and support the reopening plan. Some of those examples are social distancing is required, the hours of operation, masks are required, etc. We are also working with visual communications to create a walk and talk video for each campus. And the video will allow students to know where they need to go to sign in, where the virtual student support room is located, and where the drop boxes are also located. The drop boxes will be located outside of each of the main entrances on each of the campuses. So if a student needs to submit documents, they can leave them in the drop boxes in these locations. And again, they will be outside of the main entrances that I mentioned previously in this presentation on each of the campuses. We will also have training available for our students. Students will be informed of how to maintain safe habits prior to returning to campus by being required to review a COVID-19 safety prevention video, which will be shared through online orientation, which will be available on TCC's website. We will also have synchronous Zoom orientation sessions available in August. We will also have the videos embedded in student development courses as well as in Canvas. Also, a standard robocall will be made to students prior to the first day of class, briefly outlining COVID-19 prevention guidelines and directing students to their emails and the college's website for more information. You've heard a lot about face coverings. I would just like to echo the comments of Dr. Woodhouse. Our top priority is the health and safety of our community. And so to help minimize the spread of COVID-19, face coverings and physical distancing are required in all TCC facilities. Students, faculty, and staff are required to wear face coverings inside buildings, especially in common areas where physical distancing is difficult, such as hallways, restrooms, break rooms. They're also required in the classrooms, libraries, and labs. Students will not be permitted in the building without appropriate face coverings. In certain circumstances, TCC may grant an exception to wearing a face covering. This includes a student who has a health condition for whom a face covering would pose a danger. Students seeking an exemption should submit a new student intake form to the Office of Educational Accessibility before coming to a campus. If a student is already registered with the Office of Educational Accessibility, he or she should contact their EA counselor. There is also an addendum to the Student Code of Conduct to support enforcing students wearing masks or face coverings. If a student does not have a face covering, he or she will be directed to campus security to obtain one, or to the welcome desk, to the check-in station to obtain one. Students refusing to wear a face covering will be referred to the Dean of Student Life and Student Conduct, Dr. James Edwards. If a student is found in violation of the Student Code of Conduct, the student may be subject to disciplinary action, which may include suspension from the campus. The campus deans and academic deans have the authority to temporarily remove students from the classroom if they exhibit or report experiencing symptoms of a contagious disease. If students fail to follow the dean's instructions, they will be considered in violation of the Student Code of Conduct and may be subject to disciplinary action. These are the updates I have regarding the reopening of the Student Affairs Support Services. Before I turn this over to Matt Baumgarting, I want to reiterate that we want to continue directing students to our virtual support resources and virtual advising and registration appointments. Services on campus are to support students who do not have access to technology or need in-person assistance with the enrollment process. Of course, we will continue to monitor the guidance of the governor and the CDC as we move forward with reopening student support services on August the 3rd. I will now turn this over to Matt Baumgarting. Thank you.
Thank you, Dr. Campbell. Good afternoon, everybody. I'm going to touch on facility modifications, and then I'll touch on cleaning, and then the PPE ordering process that we've established. So Drs. Woodhouse and Campbell covered the entry points quite well. I think you got that picture. I want to talk about entrances. Again, each building has just one entrance. So obviously the Norfolk campus is pretty easy to identify right off the main street. Chesapeake campus for Pass and Whitehurst, it's the main entrances off of that campus entry road, and academic buildings, it's front door. The Virginia Beach campus will have signage out on the walkway. So we bought like 12 or 15 of those sandwich boards. So you'll see it up there with the arrows pointing which way to go, because some of the buildings have 6 and 7 entrances. So it'll be down to one entrance. And if it's very low occupancy for staff in the building, you could probably expect that the front door would remain locked. So, signage, you're definitely going to see a lot of signage. We've got the floor placards that remind the 6-foot social distancing. We've got wall signs that remind 6-foot social distancing. We've also, we're turning the stairwells into one way. So if, all buildings have at least 2 stairways, so one will be going up and one will be going down only, except in the event of an emergency. So those signs will be posted around. We've done all the plexiglass shields. We've got more in stock. If you need anything, just reach out through the campus dean. Facilities stands at the ready to make any modifications that you need. You know those guys. We can fix anything, move around. We'll accommodate as best and as reasonable as possible. As far as cleaning goes, during the day shift custodial staff, they'll be doing the touch point cleaning, which is pretty much a continuous process all day long. The night crew will do that deeper cleaning of the offices. During the day, the break rooms and the bathrooms will be cleaned at least 3 times a day. And then night, we go into the offices and we do that deeper cleaning. We're gonna come up with a system to identify which rooms are being used, which spaces are not being used, to really cut down on cleaning spaces that haven't been occupied. So that'll help out with the custodial staff. So PPE and cleaning products. The PPE task force has been hard at work, and we built up quite the supply. And so we have 45,000 disposable masks on hand. We have another 20,000 on order. We have 33,000 pair of gloves, both nitrile and latex, different sizes, even different colors. So we've got a good supply of that. 141 gallons of hand sanitizer and 100 refill bottles are on order now. And then wipes, we've got 1,765 tubes of the wipes and 3,200 packs on order. So we've been able to get those products. Lysol spray is definitely one of those products that's very difficult to get. But we have plenty of bleach and ammonia and hydrogen peroxide, so we are well supplied. So we've established like a PPE ordering process, and I want to touch on that here real quick. So teaching faculty, if you make the request to your respective dean, then that dean's office can submit a school due maintenance direct order. So that's how we're going to track supplies. So the maintenance direct order will go in, it'll go to that campus's custodial manager, and that campus custodial manager will make the delivery out of their stock. So the custodial managers on each campus are going to be like your local supply house. That's who's going to have the product. Plus we have it at the main warehouse. Administrative staff and faculty can make the request to their campus dean, and then that office will submit the school due request. In the green building, if the respective cabinet members would collect the orders and then submit the maintenance direct request, that'll get filled by the Norfolk campus custodial manager. For the Manning building, a simple email to the warehouse will take care of that. Some of the other workforce sites like the welding and the Airline Boulevard Skilled Trades Academy, if those building managers can just email the Portsmouth campus custodial manager, will fulfill from the Portsmouth campus. CMVE, the executive director can go to the campus dean at the beach campus and make that request as well. So that ordering process will start on Monday the 3rd. This week we are delivering PPE and cleaning supplies to labs, classrooms, offices, student services building, you name it, it's all going to be, we'll provide supplies to everybody's office. So you have something to start with. And then as we move out from August the 3rd, you just make that request in school due. What else? The 2,500 PPE kits that were ordered are still on the way. We're tracking. We talked to the BCCS daily about that. So I think they're stuck in Richmond. So that's about all I have to talk about. I'm sure you'll have some questions for me later on. Look forward to answering them, and I'm going to turn it over to Beth Lundy.
Thanks, Matt. There's several topics from a human resources perspective that I want to touch on this afternoon. I want to talk a little bit about employee training. Dr. Campbell outlined an extensive plan related to students, and I want to talk a little bit about employee training, returning to work, alternative work arrangements, leave benefits, our protocols when we have suspected cases. There's quite a list here. So I'm going to go ahead and jump in and get started. I'm going to start with training. The Office of Human Resources is taking a three-pronged approach to training employees. We'll have sessions geared towards managers and supervisors, our current staff, and towards new employees coming in. An interactive training session for managers and supervisors will occur later this week on Thursday, July 30th, via Zoom. Staff training will be offered in morning and afternoon sessions during the week of August 3rd, and an announcement and an invitation to attend those training sessions will be sent out via email, hopefully no later than tomorrow. New employee onboarding, that will occur as needed, as new folks are coming in. The HR training will be focused on preventing transmission of COVID through safe and healthy work practices, policies and procedures for employees to report when they're experiencing symptoms consistent with COVID and no other alternative diagnosis has been made, leave benefits available to employees, procedures for return to work following a COVID-19 diagnosis or a quarantine, the college protocol when a positive diagnosis has been confirmed, cleaning protocols, policies and procedures related to alternative work arrangements, and we'll focus on anti-discrimination as well. The training will be offered around this COVID-19 topic that will be offered throughout the fall semester. One thing that we've learned is that, with COVID, we have to adapt and be flexible. As new information emerges, as the situation rapidly evolves, as new requirements become known, we will update you and keep you informed. We'll incorporate that into our training for employees and managers. I hope that you will all participate in the upcoming training opportunities. The best thing we can do is to get educated. The more we know, the better we can manage our fears. And one of the fears that most of us have had or will have is related to returning to work on site. Some of us have already been through that. Others, it's coming up and will in the future. So I just want to talk a little bit about returning to work on site. Each president's cabinet member is responsible for determining the amount of on-site staffing necessary to perform the operations within their units in accordance with our reopening plan. PC members have given careful thought about how to ensure adequate on-site staffing in order to meet our students' needs and have communicated with their work units regarding expectations for return to work. Teleworking will continue to be an option for employees, especially those with underlying health or childcare issues, when that's feasible. In a prior town hall, I shared situations where teleworking may no longer be an option. Those situations include scenarios such as when the primary work performed is not suitable for teleworking, or when employees may not have the technology resources they need to most effectively work at home, or in cases where there's been a loss of productivity. There are some other options besides teleworking. There are things such as flexible work schedules. We've looked at hybrid telework and on-site work schedules, so a combination of in-office and off-site work, staggered on-site work schedules to minimize the number of folks in offices at the same time, change in on-site work location to ensure social distancing, physical rearrangement of workspaces, installation of the plexiglass shields that Matt talked about, and even consideration of other work options, like having employees temporarily perform other work duties and assignments. I encourage you to work first with your supervisor and your supervisory chain and loop HR in when necessary. HR is involved if there's a question regarding the alternative work arrangements policy, when managers and supervisors need guidance in handling a specific employee questions, concerns, or situations, and when there are employee requests for accommodation. If the situation cannot be solved through other alternatives such as teleworking, there are several leave options available to assist employees. In addition to our normal, usual leave benefits for full-time employees, such as annual leave for 12-month employees and sick leave and personal leave and disability benefits, during the pandemic, we also have at our disposal public health emergency leave, emergency sick leave, and emergency family and medical leave expansion for the purpose of childcare. So these three leave types, in addition to being available to full-time employees, are also available for our wage and adjunct employees. And the public health emergency leave, the purpose of the leave is specifically to permit or require employees to attend to their own medical needs or those of an immediate family member related to COVID-19. So that's in cases where a person is unable to work when exposure is suspected or diagnosed. It's also when an employee has been mandated to quarantine by a government or public health official, or asked by the agency to self-quarantine. So if we ask you to self-quarantine, then public health emergency leave would be an option that is available. To care for a family member that is symptomatic or diagnosed with COVID-19, you could also use public health emergency leave. And it may apply to employees with chronic medical conditions that make them high risk due to COVID-19. If the ability to work remotely or telework is not possible, public health emergency leave provides 100% pay. And it's based, in the case of a part-time employee, it's based upon work schedule. Potentially under public health emergency leave, an employee could request up to 4 weeks of leave based upon the regularly scheduled hours of a part-time employee. So as a full-time employee, it's a regular 40-hour work week. This public health emergency leave, any requests to take that need to be coordinated through the Office of Human Resources. Supervisors, employees must work with us when requesting to use that type of leave. The next type of leave is emergency sick leave under the Families First Coronavirus Response Act, which was passed and became available to employees beginning in April. This provides employees with paid leave if they're unable to work or telework due to any of the following reasons. Subject to quarantine or isolation, has been advised by a healthcare provider to self-quarantine, is experiencing COVID-19 symptoms and is seeking or has been given a medical diagnosis. In those cases, the emergency sick leave provides 100% pay. For up to a 2-week period and up to, it is based upon, there are limits in terms of earnings. So up to, the maximum that a person can be paid is up to $511 a day. And this provides 2 weeks of leave. And there is a form that if you're requesting this type of leave that you would submit to the Office of Human Resources. Again, any requests for leave, you want to work with your supervisor to determine if other options are available before taking leave. And I do want to note that fear of coronavirus, fear in and of itself, is not covered by the Families First Coronavirus Response Act. So additional reasons for utilizing the emergency sick leave would be in caring for an individual subject to an order described as self-quarantine or they're diagnosed, in caring for a child under 18 whose school or daycare is closed for reasons related to COVID-19. And in those cases, pay is at 2/3 pay. So it's not 100% pay. And again, up to 2 weeks for that. The emergency family and medical leave expansion related to child care is when an employee needs leave to care for their child under age 18 because the school or child care provider is closed or unavailable due to the public health emergency. And again, available only to employees who cannot telework. And the first 2 weeks of this are unpaid unless an employee is utilizing the emergency paid sick leave that I just described, or annual leave or family personal or those types of leaves. And again, pay is 2/3 of salary for up to 10 additional weeks using expanded family and medical leave. And there is a request form specifically for this purpose. And again, work with the Office of Human Resources on any of these leave types. But these are the additional leave types that are available as a result of the pandemic and available. So please work with your supervisor in the Office of Human Resources related to that. So I do want to talk for just a second regarding returning to work following a COVID-19 diagnosis or quarantine. Essentially, employees are required to follow CDC recommendations when ending isolation. And when an employee may return to work and be around others, it really depends on different factors for different situations. For example, CDC guidance right now is to stay home for 14 days from the time you return home from international travel. There are currently no quarantine requirements upon arrival in Virginia from travel within the US, but the Virginia Department of Health does encourage you to check with state or local health department for any travel restrictions, stay-at-home orders, or quarantine requirements upon travel. So that could change at any moment. So being aware and up to date of those things. Regarding an employee returning to TCC, employees who have been diagnosed or as having a contagious disease must be free of all symptoms of the disease for at least 7 days since the date of the first report or diagnosis, or as otherwise recommended by a healthcare provider, the CDC, or other public health officials. An employee also should provide written documentation from his or her treating physician or primary care provider documenting that the individual is medically cleared. Given COVID, that may be difficult to receive, but a negative test result will also suffice as documentation for return to work. So in suspected cases, while waiting for test results, we have encouraged employees, we have had employees stay away from work to reduce the spread and to keep others safe. We're encouraging supervisors and employees in that situation where they're waiting for test results to utilize teleworking options or leave if the teleworking options are not available. But we need to all do our part to keep each other safe. So far as workers' compensation, the Commonwealth of Virginia utilizes a third-party administrator to manage all of its workers' compensation cases. That third-party administrator makes the determinations regarding compensability of claims. TCC is not involved in that decision. We have no control over whether a claim is approved or denied. If an employee contacts our office, the Office of Human Resources, and requests to file a workers' compensation claim related to COVID-19, we will submit the claim to the third-party administrator for their review and determination. And now I want to talk a little bit about employee compliance with safety measures. Dr. Woodhouse and Dr. Campbell spoke regarding the requirement for wearing face mask. The safety measures that are in place, wearing of protective face coverings, social distancing, hand sanitizing, frequent hand washing, it's really about common courtesy to our colleagues and coworkers. COVID-19 is scary for all of us, and we need to be mindful that as a community, our levels of fear may be different. Thinking about how others may be feeling and taking actions to show others that we're concerned for their well-being as well as our own, that'll go a long way. Before getting on an elevator that's already occupied, asking if it's okay for you to get on before you just get on, that's a courtesy. I had an employee this morning, I was in a meeting and I had an employee in a face-to-face meeting, and I had an employee that came into that meeting and there was some available seating near me. And before she sat down, she asked me if it was okay, if I minded if she sat near me. And I just thought that was very courteous of her to do that and very mindful. That's not always going to be the case. If you're uncomfortable with something a colleague is doing or not doing, then I encourage you to have open dialogue. If you're not comfortable doing that, then report the behavior to your supervisor and or to HR. If a colleague or a coworker is at work and exhibiting symptoms, report it. We all have some accountability and must take responsibility for keeping one another safe. This is not administration's responsibility. It's not faculty's responsibility. We are all in this together. In cases where an employee repeatedly does not comply with safety measures and precautions, progressive disciplinary action may be used. And that would be in consultation with the Office of Human Resources. We would be involved in any of those actions. So I think there was also, I know I've talked about this before, but I think it's worth repeating. During our last town hall, I shared that the Department of Human Resource Management does not recommend that state agencies initiate a process to take body temperatures of employees. Taking an employee's temperature is considered a medical exam, which necessitates consistency in application and a potentially complex administrative process. The Center for Disease Control has indicated that some people with COVID-19 do not have a fever. Also, certain medications or other medical conditions may cause an elevated temperature. Rather, the approach we're taking is to encourage employees to take their own temperature in a home setting and do not report to work if they have a fever of 100.4, 100.4 or higher. We also ask that employees who are exhibiting symptoms consistent with COVID-19 to stay home. According to the Centers for Disease Control and Prevention, symptoms consistent with COVID-19 include cough, shortness of breath, fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, new loss of taste or smell, fatigue, congestion or runny nose, nausea or vomiting, and diarrhea. So this is an extremely stressful time for all of us. And I just want to, as a reminder, put in a plug for our Employee Assistance Program. The Employee Assistance Program is here to assist us through these challenging times, through the fear of the unknown, the uncertainties. And the Employee Assistance Program is not only available to our full-time employees, the full services and the full scope is available to full-time employees, but there are, they have opened up employee assistance services to wage employees related to the website, the online services at no cost to the wage employees, part-time employees. So that is available, but things such as face-to-face counseling, telephonic counseling, those are not included in the services offered to our wage employees. But there are resources available, and if you have questions or need references or assistance with that, please don't hesitate to reach out, and I'll share what information I have. So with that, Dr. Conston, I'm going to pass this back to you.
Thank you so much. And thank you, Michelle and Karen, Matt and Beth. You all were very thorough in your communication. And for our college community, I hope you all see that we are taking multiple measures to provide a safe environment for your return. And also, we are trying as best as we possibly can to provide as much information to you. And I hope that is evident in the conversations that we've had so far. We want you to know that we are concerned about your safety, your health, as well as the health and safety of your family members as we think about reopening the college. I also want to let you know that our plan, our reopening plan, has been approved at the state level by the State Council of Higher Education for Virginia, as well as the VCCS. As I mentioned, as we started the conversation, a great deal of work and a great deal of thought were both put into developing these plans, and I guess you could see it is evidenced by the conversation we've had so far. Beth touched on a lot of things that relate to many of the questions that came to us during the past several days. And so we're hopeful that the information that has been shared will answer many of the questions that were raised earlier. I also want to let you know that we welcome additional questions or comments that you may have. So at this time, I'm going to turn the conversation over to Dr. Kim Bovee, who will serve as our facilitator to address any additional questions that may come through. We want to hear from you.
Hi, thank you very much. I just want to say that I'm having quite a few questions and emails come in to me at this point. If anybody doesn't know my email already, it's kbovee, BOVEE @tcc.edu. I do want to start with one that has been, I think, talked about a little bit, and I just want to reiterate again, we have received a tremendous amount of questions, and I think everybody here is doing their level best to make sure that we answer those questions in all the different capacities they've been asked. But one of the questions that I think has been touched on, but I want to ask the President and the Cabinet to address even more directly, is this issue of staff, faculty with underlying health conditions. We're receiving a lot of questions, concerns, whether it's with age, asthma, diabetes, upper respiratory, or caring for those. What specifically is the college doing to think through that process for faculty and staff and all employees who are dealing with very significant underlying conditions?
Well, I will start by just responding to what Beth has said earlier, and I will shift it over to Beth so that she can reiterate some of the points that she made. But one of the things that she mentioned, and this is something that we've talked about at length at Cabinet, each vice president or each president's cabinet member working with your staffs will work to address every employee in your respective units that may have some type of underlying health or child care condition that they wish to explore and work through what type of work environment they will be able to have. So that is work is left at the level of the vice president or cabinet member working specifically with the employees. We want you to be safe. We want you to be healthy. And we want to ensure, as I said earlier, that you have the mechanism, particularly as it relates to childcare, to ensure that you're able to do your work and also maintain your life with your children. So I'm going to turn it over to Beth and just ask if you will quickly reiterate, because you went into great detail about underlying health conditions and childcare issues, as well as the various types of leave, and particularly the 3 additional types of leave that we have during this time of COVID-19. So if you will quickly reiterate that again to respond to the question.
Thank you, Dr. Conston. So just to reiterate, this is an interactive process, talking with your supervisor and talking with the Office of Human Resources to take a deep dive about what specifically is concern in your work area. And a lot of times we have been able to address by taking a deeper dive into what those concerns are and coming up with alternative solutions. And I mentioned many earlier. So I would encourage you to start that conversation with your supervisor. And again, your supervisor and you can loop the Office of Human Resources in when necessary. But taking a deep dive as to what those specific concerns are, can they be mitigated? Are there steps we can take in cases where employees cannot telework? Of course, teleworking is an option. Thank you, Dr. Conston.
Thank you. Another series of questions that have come in are more specifically from teaching faculty, and I'm going to lump a couple of them in here together. But I've had several requests for a review of the procedures and requirements that the college would like teaching faculty to do to begin getting ready again for teaching remotely this fall, and also to speak a little bit about faculty evaluations and how those evaluations may change under the circumstances, such as, for example, classroom observations maybe have to be shifted. So a couple of the questions really deal with getting ready and helping teaching faculty prepare for this fall.
Okay, that's another excellent question and great point of discussion. And so I'm going to ask Dr. Woodhouse. Again, I will say that many of these processes are continuing to evolve, but Dr. Woodhouse, I would ask if you will speak to what we're doing as it relates to teaching faculty, evaluations, et cetera, at this point.
Thank you so much, Dr. Conston. So at this point, we're working very hard to prepare for faculty's return to campus and for their work online. In terms of the faculty evaluation, we are working on that presently and what that will look like and how that will exactly be done. I cannot give you the exact answer right now of what that will entail and how those exact evaluations will take place, especially those that are up for the summative process. But we are in the process of working out a process, and we'll be discussing that with the Senate, and also we'll be sharing that with the faculty to come within the coming weeks, particularly during the convocation week. We do have a series of activities that are scheduled during the faculty convocation week that are scheduled during the week of August the 20th. And we have trainings that will come. These are virtual training sessions that will come that we'll be sharing with you within the next week or so. And these are all activities designed, prepared to bring the faculty back and to prepare you for what life will be like as a faculty member during this time, during the COVID-19 timeframe. To talk a little bit about some of the things that faculty can anticipate. In terms of faculty, we're revising the syllabus builder template. Faculty must use, of course, the syllabus builder template for the fall 2020 semester. We're revising the template to include the COVID language. That is very important so that it will have all the necessary information for the student. We're also going to provide a training video for faculty as well, and that will also be shared during the faculty convocation week as well. So we are putting some things in place for faculty upon their return, but we have not worked out the details in terms of the evaluation, but we will know those details within the next week or so. And we intend to share those with you upon your return during that faculty convocation week.
All right, thank you very much. Another question that has, several questions have come up regarding our students in a number of different capacities. So this may involve several answers from several cabinet members, but could we address how this will affect COVID-19, how it will affect our ADA requirements and meeting those guidelines for ADA, and also how this may affect our work-study students and other student employees? Are there special things that as an institution we need to be aware of to help protect our student workers and our students themselves who may have extra challenges in these difficult times?
So I will ask Dr. Campbell. I will ask Dr. Campbell if she will speak to that question. But before, Karen, before you come on, I just want to say that one of the things that I was writing down, Kim, as you were asking your question, was that we are going to have a couple of sessions to speak directly to students. That's going to be very important, and that's something that's already in the works at this time. And also, I just want to say before I shift it over to Karen that right now, we have about, I've gotten a number that we have a little over 350 people, about 350 people listening to this Zoom message. So that lets us know how interested you are in what we were saying today and how important, as we all know, and critical this matter of COVID-19 and our reopening plan is. So before we end this session, one of the things that I would like us to talk a little bit about is our continuous marketing and communication that we will have in place for you going forward between now and certainly August 24th. And so before we end, I will ask Dr. Bove if Marion will come on to give us an update on our marketing and communications plan. But as it relates to the question regarding students, Dr. Campbell, if you will respond to that, I would appreciate it.
Yes, of course, Dr. Conston, and thank you so much, and thank you for the question. As it relates to ADA compliance, I've been in contact with Beth Callahan, and so we do have a process in place for students. If what the question is referring to is students who perhaps are for unknown reasons unable to wear a face covering. And so we have a process in place in which those individuals can reach out to EA which are our educational accessibility counselors, in order to receive a card that they will have on them in the event that they are unable to wear some type of face covering. And so she has a process in place to support those students and to ensure that they are comfortable and have what they need prior to returning to the campus. So we do ask that those students who need to speak with an EA counselor actually complete the intake form before they return to the campuses. If they are already a current student, they need to get in contact with their current EA counselor. And so as it relates to our student workers, as Dr. Conston and the President Cabinet has stated, we really are concerned about the safety of our staff, students, and faculty. And so we want to ensure that they are safe as well. And we will continue to have conversations as we begin to reopen about what that will look like for them on the campuses, if they will be on the campus at all. If they will not be on the campus, what work can they assist with, perhaps via Zoom? But we are having conversations around that. And so we will have a more specific answer as we move forward. Thank you.
All right, thank you for that. One of the questions, or one area of questioning that is frequently has come up, and I think everybody's done a really good job of answering it so far, but is that question of what to do with non-compliant, whether it's non-compliant faculty, staff, colleagues, non-compliant students, non-compliant community patrons. And specifically, while that has been addressed, I wanted to ask for some more specifics on how security will be involved and used in this process to ensure compliance and that everything runs smoothly at the campuses as we deal with questions and maybe some people who are not keen on wearing face masks or doing social distancing.
Okay, I will ask Dr. Campbell, and perhaps if Matt has additional comments surrounding security, but one of the things that was mentioned earlier is that we will have one way in all of the buildings, and at each building, that location entrance into the building will be manned by security. And so at that station, as an individual seeks to walk in that facility, they will have to stop and sign in, and also use hand sanitizer. There are hand sanitizing machines there available. And so security will be able to respond if that individual is not wearing a mask at that time. So we plan to employ our security as we always have, but certainly throughout all of the campus locations that will be open, and they will have a high level of responsibility for ensuring that all of us are following protocol. And I will just say that as we think about following protocol, this has already been said, but that we have to set the examples. And particularly those of us who are in leadership roles, we have to set the examples for the rest of our staffs. If we're walking through the hallways and if we're congregating at the elevator or break rooms and not social distancing or wearing our mask, then what would we expect the employees to do? They're going to do just what they see us do. So we have to set the example. Certainly, our security will be in place, but it is up to us to ensure that we're doing everything that we can possibly do for this college and this community to provide a safe and healthy environment. And I will tell you, it starts with us. Everyone that's on this call, as going back to what Beth said, if you take that level of responsibility to look out for not only yourself, but also your colleague, then we can see a difference being made in our community, which is what we are all aiming for. So I will turn it over to Karen, if you would like to speak a little bit more about the role of security as we roll out our reopening, please.
Yes, thank you, Dr. Conston. So as you stated, security will be at the entrance points of all of the buildings, and students, staff, faculty will not be allowed to enter the building if they do not have a face covering on when they sign in. Now, if for some reason, let's say a student is in the building and then decides that they're going to remove their face covering and become non-compliant, then security will work with the campus deans to assist when a student is being non-compliant. And as I stated in my talk, we do have a protocol in place and policy in place to support the removal of a student from a classroom and then even perhaps from the campus if they choose to be non-compliant. And these students can possibly face disciplinary action depending on the situation. So we do have a process in place to ensure that people feel safe and that they feel supported, and that the faculty also feel supported as they're teaching in the classroom. So for example, if they're teaching and a student decides to remove the face covering, they should be asked to leave the classroom, and the campus dean and security should be called, and that the situation would then be turned over to them. So thank you.
All right, another question that has come up because this process and this whole situation is so fluid and ongoing is, how is the college going to evaluate the effectiveness of these training videos, even of these town halls, of questions in the upcoming months? How are we going to look back and see and improve ourselves in terms of responding to these various questions? Will there be some evaluation and effectiveness of TCC's response?
Thank you for that. Thank you for that question. And you know, that's something that we're working through. The evaluation is going to be very critical. I wish we could say that we can evaluate the effectiveness based on the number of COVID cases that we don't have at the college. However, we can't say that because we know that the college community is just one environment in which our faculty and staff operate. People go multiple places other than the campus, our campuses. So those are evaluation of our procedures is definitely something that we as a cabinet will sit and talk about and see what measures we could put in place to evaluate whether or not our environment is proven to be safe and effective. So that is something that we will definitely have to get back with you on, but I want you to know that it is certainly a priority for us to be able to put some measures in place to determine whether or not the things that we're doing are or are not effective. And if we find out they're not, certainly we will re-strategize and we will try to do something different in order to ensure that we are providing a safe environment for each of our employees and each of our students who find themselves coming to the campus for some type of service they could not receive online. So more to come.
Great, thank you. And I know we want to leave some time to talk about marketing and communication with Vice President Anderfuhren, but before we do, there's one question that has come up a couple times in the last 30 minutes, and that is with regards to what kind of partnership are we doing with our K-12 partners, whether it's with dual enrollment or communicating with them about their moving. And of course, as we all know, they are facing very similar challenges to what we are, but has there been some solid communication with K-12 in an effort to address those student needs, those high school seniors, those juniors who are not quite sure what to do, and also dual enrollment?
Absolutely, there has been a great deal of a collaboration, and I see on the Zoom that Dr. Woodhouse is smiling because she and I had a conversation about some of the things that they're working on right now. So I will turn this over to Dr. Woodhouse for further comment.
Thank you, Dr. Conston, and thank you very much for that question. We have had ongoing conversations with the school districts really since the onset of COVID, and really since we had to go to the shutdown and go to remote instruction. We are actually engaging this week in virtual conversations with each of our school districts. But even prior to these meetings, we have continued with active communications with our school districts and with our faculty. We really have never stopped. And for us, it has really been business as usual. But at the college right now, we are actively transitioning to a college-wide dual enrollment model. And as we transition to this model, we are looking to actually move to a model where we can better service our students and service our partners in a college-wide model to ensure that our processes and our functions and the way that we work with our students are more in a collaborative and a consistent approach across all 4 campuses. This week, we will be launching this process as we meet with all 4 school systems, and we begin to share our new model as we begin to talk about what we will be doing and what the new model will look like. But also at the forefront of this conversation, we'll be talking a great deal about enrollment for the upcoming fall semester. This is a very difficult time for the K-12 system. I think we're all hearing that all of them are going online. What we're going in and hoping is, can we recoup some of that enrollment? Can we get some of those students enrolled here at TCC? So we're looking to have some of those aggressive conversations this week. They actually start tomorrow. And so we are looking to have those dynamic and courageous conversations and hope that we have some of the courses and the things that they need to get some of those students engaged. And so we're looking forward to those conversations, and we're looking forward to being able to meet the needs of the school districts and going forward. So stay tuned for more to come with our new college-wide dual enrollment model. Thank you. Thank you for that question.
All right, one last question before we turn it on to Mary and Andrew, and I want to leave the last 5 minutes for President Conston to do some closing questions. I am still receiving a few questions coming in, and we may have to follow up with written answers on some of these. So for those of you who have just sent me emails, I might not be able to get to them today. But I do want to ask one more question again before we send it over to Mary and Andrew to discuss marketing communication. And that's, we have several questions coming about enrollment. And not just our enrollment, but how we are faring against other institutions, and are other institutions actually experiencing surges, and where do we fare in the system, as well as community colleges nationally. So I assume this is probably a question for Dr. Asen, but President Conston, I'll pass that on to you.
And I assume that if the question is in terms of faring, in terms of the number of cases we have and that type of thing, we do not have that information as it relates to the other institutions. However, I will say that we have been asked by the system office to report our cases directly to the system, and that information goes directly to the system, you know, as a part of just reporting. They ask that we do that just so that the system will be informed. However, I don't have, nor have I received any aggregate information system-wide in terms of the number of cases that have been reported for all 23. So as far as we know, that data has not been shared across the system. And the most data that we have, not necessarily as it relates to any college, is simply what we see in the paper every day. And that's the number of cases that have been reported in the Hampton Roads area, you know, the number of new cases, the number of hospitalizations. So that's the only information we see. I imagine that only our local health departments or our state health department will have that level of data about a particular institution. I'm quite sure that that will not be shared. I will ask Beth if you have any additional comments regarding data, and perhaps if Kurt has some additional comments about data that may have been shared.
Thanks, Dr. Conston. We have had 3 confirmed cases of employees working on site, and they're all isolated. They are not connected in any way. And you know, that's really all I have to report there. We have not been able to connect that, but we are In all cases where there's a positive, confirmation, we do work with the health department, and we talk with the individual to try to determine and make sure that our other employees, that they're safe, and to notify affected individuals in case they need to self-quarantine or get tested or those types of things. But all of our cases have been isolated. They are spread out. There's no connection or anything between them. Thank you.
Thank you. I know in the media, we've heard across the country, there may be a surge in community college enrollments. However, Virginia has not experienced that. As of today, there are only 2 colleges that are barely above where they were last year, and those are the 2 smallest colleges in the system, Eastern Shore and Paul D. Camp. Tidewater falls generally about the middle of the pack as percentage-wise down. There are colleges that are doing far worse than we are. There's colleges doing a little bit better than we are, but everybody is down. We have not seen a surge hit us yet. I had a long conversation last week with Dr. Finnegan at the system office on enrollments, and we are not seeing a surge across Virginia at this point. It may come, but we're not seeing it. Problem with comparing our enrollments right now as I normally would is the timing differences of several different things that it's making an apples to oranges comparison. However, when I adjust for the start of classes, which are a little later this year than previous years, as well as the change in our enrollment cancellation. Remember, last year for this fall, we eliminated our first enrollment cancellation. Those don't make for good comparisons. However, when I adjust for them, my estimate is that we are currently down 19%, which again puts us right in the middle of where the system is. Thank you.
All right, our time is winding down fairly quickly, so I want to go ahead and give an opportunity, as Dr. Conston asked, to speak about marketing and communication with regards to this and moving forward as we deal with this crisis and try to get our jobs done and improve enrollment.
Well, good afternoon, everybody. I wanted to talk about the phases of what we're doing. You may have seen some fresh television commercials. They've been out maybe a month or 6 weeks now that highlight TCC's role in the community and kind of give that emphasis of the fact that most of our classes are going to be online. At the end of the commercial, there's a girl sitting at home with her mortarboard and her diploma. So that sort of takes that message home, hopefully, to people, and also lets people know that TCC has been for 50 years, training the people who are needed in our community, and they highlighted people who cook, people who do healthcare, people who take care of cars. So I was pleased with those. The immediate need for communication is around this August 3rd reopening, which is next Monday. And we have a series of communications ready to go. Kind of wanted to wait till the town hall was over. But now we have emails going from the president to current students. We have an email going to prospective students. We have updates to the website that are ready to be posted. We have signage lots of signage that's going to be on the campuses by August 3rd, hopefully earlier than that. And also, emphasizing the August 3rd availability of student services on campus. I think that's going to be huge for a lot of students. And so I'm really, on the one hand, I hate to see thousands of students come out because that could be problematic from a public health point of view, but I think I hopefully see a lot of students, a lot of our students, they want to talk to somebody. They want to have somebody explain things to them and hold their hand. So I'm hoping we'll get a big reaction to the August 3rd reopening. we're also going to put out a news release about that, by the way. So hopefully that'll get picked up. On the return for fall, it's that's a little more multi-layered. Again, lots of web updates about this is what different online classes mean. This is what asynchronous means. This is what synchronous means. This is what hybrid means. Also a guide, like what do you need for technology to take online classes? And then also, if you're coming to campus, if you're one of those students who's going to be coming for a health professions class or an automotive class or an art class, what can you expect when you show up on campus for your classes? And what are the protocols you're going to have to start observing? So we're doing we're doing signage, we're doing videos. Karen talked about the student training video that's about ready to go, and we're doing things on our website. We're doing things in the media, and we're also sending direct communications to students. And I'll turn it back over to Kim.
All right, well, we're down to the last 5 minutes. So I wanted to go ahead and let Dr. Conston summarize and finish up. Before though, Dr. Conston, I'd like you to say something about the availability of this town hall. Will it be available for people who have been unable to sit through it right now? And if so, when? And then if I could just invite you to make some closing remarks. And I want to thank again everybody in the college community for sending a lot of really good questions, for helping me clarify questions when I had other, or I wasn't sure what was meant. And also for those of you who have very recently sent me questions, we'll have to figure out a different way to try to get back with you on that. But again, thank you to the community for all of this. And I'd like to let Dr. Conston go ahead and close this out. Dr. Conston?
Thank you very much, Kim. So I keep hearing an echo, but I think I'm okay now. Yes, in terms of this presentation, I understand that it is being recorded and it will be available on our website for future review. So anyone who has missed it can certainly go back and take a look at it. I think you will find this video, those of you who will maybe want to go back and revisit it, and those who will eventually log on to see it, you will find it to be very helpful, as also you will find our reopening plan to be very helpful. And I also want to just speak to the last question that was raised. I understand that that question was directly related to our enrollments. So thank you, Dr. Bove, for raising that question. And thank you, Kurt, for responding specifically to the enrollments. I was thinking that since we were in this COVID conversation, I was thinking that it was specifically about the number of COVID cases, but it was about enrollment. And Kurt gave us a good review of where we are with enrollments. And we are looking at our enrollment data every Monday in our cabinet meeting. So we are very in tune to enrollment. So thank you very much, Kurt, for that. I just simply want to close my remarks by once again thanking our faculty and staff for all of the things that you did starting around the middle of March to help us transition to our remote learning environment. And you have been steadfast in your work, and it is most appreciated. Even as we make plans to reopen for the fall, and as we said, for many months, the campuses were closed, but the college remained open. So as we plan to reopen for the fall in terms of providing some type of in-person, but 95% or 98% online classes, I really do value and appreciate your support and your engagement in the work that we are trying to do. I also want to just remind you that we are working, as I said earlier, in compliance with the governor's orders, as well as all of the CDC guidelines, as well as the BCCS guidance. And we will continue to do that. And if going into this fall, things change, which, it stands a good chance that things may change, given the fact that our numbers as it relates to COVID, those numbers are beginning to tick up in the Hampton Roads area, as we see in the newspapers every day and from watching the news. If we receive another mandate from the governor, such as he moves us back to phase 2 or even phase 1, God forbid, we will pivot. If we have to pivot, we will do just that. And we stand ready to do that at any time. We will remain certainly ready to rapidly respond, and we will comply. But in all of that, we will do our absolute best, as Marion has said, to continue to keep you informed and communicate frequently about the things that we're doing at the cabinet levels, and communicate with our students as well as our board and the community at large. So again, I would just simply close by thanking all of you, particularly the faculty, staff, and most particularly the cabinet, for your excellent work during these past several weeks to prepare us for today and for August 3rd and for August 24th. And we will just stay tuned and see what happens going forward. So thank you all for what you're doing. And I look forward to seeing you at our fall convocation event, which will be virtual. Thank you so much.